So, different reasons drive people to take their own lives, and that is what we need to analyze and help them out.
Social risk factors which can drive a person to attempt suicide.
They will always feel that they could have done something, that guilt will never go.
I am Dr. Kathleen and Mathew, working as senior resident in the Department of Psychiatry at Amrita Hospital, Kochi. Globally, September 10th is observed as World Suicide Prevention Day. Today we have with us Dr.Bindu Menon, Professor and Head, Department of Psychiatry at Amrita Hospital, Kochi, to enlighten us about the importance of this day. I welcome you, ma'am, to this talk.
Thank you, Kathleen.
World Suicide Prevention Day is celebrated on September 10th every year. Could you tell us about the significance of observing this day, ma'am?
It was in 2003 that the World Health Association decided to celebrate this day, can't call it celebration, okay, celebrate this day to create an awareness basically about suicide. Suicide is an important mental health problem because at least 1 in 100 people die of suicide every year. This major mental health problem, and the WHO has decided that it should be a focus of attention. So, at least a year there should be programs all over the world where people are told about the reasons for suicide and how they can help prevent it. That is the reason why September 10th was a day selected for this particular celebration of World Suicide Prevention Day.
Ma'am, could you tell us what can be some of the reasons that drives a person to commit or attempt suicide?
Suicide is a very complex phenomenon. There are different reasons why and different kinds of people who attempt or commit suicide. First of all, let me differentiate between deliberate self-harm and suicide or completed or attempted suicide. In one, there is a need to die, or the want to die is the first thing, that they do not want to continue with their life anymore. The second is a self-harm, which is usually a cry for help or a manipulation of the environment. So, there are environment or people around them, it would be the social environment, it should be trying to get out of some kind of terrible distress. But whatever the reason, these people invariably end up harming themselves either way. So, there are these two categories of people. The commonest reason why people attempt or try to harm themselves or attempt suicide is out of some kind of disappointment or some kind of thing in their life which has not worked out. And such people usually have very low coping skills. They have problems with impulsivity, they have problems with low frustration tolerance. So, certain personality traits are what drive some people at least to suicide. There is a second category who find that they are not socially connected. So, many of them feel alone, loneliness, lack of social connectedness, and this is an important factor in COVID times. So, that could be one of the reasons why the suicide rates are increasing during this time. The third category of people would be people who are having a serious mental illness like severe depression or psychosis. So, different reasons drive people to take their own lives, and that is what we need to analyze and help them out.
Like you have pointed out, ma'am, there are certain individual as well as social risk factors which can drive a person to attempt suicide. Are there any warning signals which could be identified by people around the person who is at a risk of suicide?
Certainly, because warning signals are always there, but people have to be sensitive for those. Many a time people who have attempted suicide have made clear their intention in some way or the other. Sometimes they talk about suicide, they say that or they talk about things like what will happen when I am not there, or this should be done when I am not there, or they make a will, or they plan so that they are paying up their payments or do something which will indicate that they are not going to be around for some time. So, if this is picked up by the family members, then it is easy for them to bring them to help or try to talk it out to them. What happens many a time is that even if somebody mentions that they want to kill themselves, it is dismissed because we feel very uncomfortable with this whole idea, or it is laughed at it is made a joke of, sometimes it is just said nothing, you should not be talking like that. So, it shuts down the conversation. The point is, if somebody is talking about these things, there should be an open conversation and a discussion and an attempt to get that person to seek help.
Ma'am, like you said, once we identify the warning signals, it is important to get help for them. As individuals, how do we actually reach out to the person who is at risk of suicide?
Actually, nobody wants to die. I would not say that there is anybody who is 100% determined to die. There is a lot of ambivalence, there is this to be or not to be question often asked. So, even if at the last minute there is a small thing that can actually dissuade the person from committing suicide. There have been instances where the person has decided to do something and there is a phone call which comes, and it may be a neutral phone call of a friend, and their mind changes. So, it is a question of holding on and letting the impulse pass. So, in that period we certainly can reach out to that person. That is why suicide helplines are so successful in preventing and helping people who have these kind of ideas. As individuals, if your friend or somebody else is feeling suicidal, being with that person, supporting that person and talking to that person will actually let that impulse pass many a time.
There is a general notion that talking about suicide can be considered as an encouragement to commit suicide or make that person more prone to actually act on that. Is there any fact behind that?
Certainly not, that is a myth. Like I said, we should be actually encouraging the person to talk about, because this is not something you can put into anybody's head. The myth is that if you talk about suicide, this person will get that thought in his head which is not there before. No, such a person who is already feeling suicidal and who is actually coming out with that idea already has the thought in his head. So, you are not going to put anything new there. What you can do is let him express, him or her express the whole problem to you, and that can actually help ventilate and solve the problem itself. In minor cases, that itself is enough to help the person come out of that kind of thought.
Like there are risk factors which can drive the person to commit suicide, are there also certain protective factors which will prevent the person from committing suicide?
Resilience is one thing which we have to study. Most people focus on why people commit suicide. The media celebrates suicide, I would say, because there is a lot of discussion about what drove that person to suicide, and it can result in copycat suicides in vulnerable people. What actually happens is that you have certain protective factors. Like I mentioned before, people who are not socially connected tend to attempt suicide more, because they do not feel there is a purpose of their existence in this world. So, if you can have a higher purpose or a higher meaning in life, or have something which binds you to society, then that can prevent suicide. That is one of the protective factors. Then personal factors like a sense of mission or feeling that you have to be there, you are responsible for something. It could be anything, it could be a family, it could be elderly parents, it could be anything, your children, it could be your job which is important to you, or it could be something you want to accomplish. So, if these factors are there, then again suicide is something which is far from your thoughts. The sense of like I said, connectedness and spirituality is another thing. Religion, certain religions of course think of suicide as a sin, it is not supposed to be done. So, such religions actually are helpful in preventing suicide. If somebody is of that religious belief, that can actually deter the person. Other than that, even if you are not following an organized religion, a spiritual sense of purpose and a higher meaning in life can actually prevent suicide. So, there are many factors which actually promote resilience and prevent a person from going in for this drastic step.
On this International Suicide Prevention Day, do you have a message for people who are distressed or who are currently going through a crisis situation, ma'am?
Yes, I would like to talk to youngsters especially who think that they must never fail. That is something which is a misconcept. We all have failures, and we all may have instances where we are not able to achieve what we want to achieve. There are disappointments in life. Life is never going to be smooth. So, the moment an obstacle comes, the first thing should not be about ending your life. It should be about facing problems and growing as a person. So, challenges will be there and you need to face them. And this is not, it is an option, but is it the correct option is the question. Is it something which will bring happiness to you, make you grow as a person, and will you learn from it? So, committing or attempting suicide is only going to distress a whole lot of people around you. And another thing I want to talk about is survivor guilt. Many people have felt this, including doctors who have tried to help people. So, those who go ahead and attempt suicide anyway and actually manage to kill themselves, what happens to the people who are left behind? They will never get out of it. They will always feel that they could have done something. That guilt will never go. The feeling that you could have helped someone, or there might have been something which you have missed out, or some place where you should have been for them when you were not there, or the phone call that you did not take when they called you. So, these things are going to create guilt in their life forever. That is what you have to think of when you are trying to. Everybody has felt suicidal at one point or the other in their lifetime perhaps, but people do not act on it. It is just that it is just some time that you have this impulse. You let it pass and you ride it over, and you will not feel that again. And you need to deal with your problems basically. Another thing is that what if you land up being worse than before? Suppose I have seen patients who have tried to hang themselves. Partial hanging has resulted in the blood flow not going to the brain, and they have landed up worse. They have no memory, no cognition, they have to be looked after by other people. So, do you want that to happen? Because there is no 100% foolproof method. On another note, yes.
Thank you so much, ma'am, for taking your time out and sharing these important facts about suicide prevention and giving such a powerful message, especially to the youth who have increased suicidal risk in these times.
Thank you.
On this World Suicide Prevention Day, let us all pledge to join hands and renew our efforts towards suicide prevention and be a beacon of hope for our fellow beings. Thank you all.